local environment.
Topic of presentation today is CT scan and MRI basics. By the end of this presentation, the audience will be able to describe physics of CT scan, enlist uses, indications and contraindications of CT scan, interpret important ophthalmological CT scans, explain MRI weighting, discuss image enhancement techniques in MRI, and compare CT scan and MRI. What does CT scan stand for? Computed tomography. It uses X-ray beams to obtain tissue density values. The detailed cross-sectional images are then formed by a computer. Tissue density is represented by a gray scale, white being maximum density, which is shown by bone, and black being minimum density, which is shown by air. Images are acquired in an axial form and can be viewed in any plane using computer reconstruction. The following figure shows three planes: the coronal plane, the axial plane, and the sagittal plane. Yes. This is the coronal plane, this is the axial plane, and this is the sagittal plane. Technical advantages over MRI are that it has multiplanar information, it is widely available, it is easy to perform, relatively inexpensive, and quick. Important clinical indications are in the detection of bone and calcifications. So, in ophthalmology, orbital trauma is detected best on CT scan. For detection of bony lesions such as fractures after road traffic accidents, blood, herniation of extraocular muscles into the maxillary sinus in case of blowout fracture, and surgical emphysema also in the case of blowout fracture. Also, in the evaluation of extraocular muscles and thyroid eye disease, CT is best investigation. Bony involvement of orbital tumors like bony impingement and bony erosion can also be assessed better using CT than MR. Orbital cellulitis uses high resolution non contrast CT scan for assessment of intraorbital extension and subperiosteal abscess formation. Intraorbital calcifications in cases of meningioma, as it has some MoMA bodies which produce calcifications, and retinoblastomas, and detection of acute CVA, cerebral or subarachnoid hemorrhage, which is harder to visualize on MRI within the first few hours of onset. Also, when MR is contraindicated, CT is the first investigation, as in case of ferrous foreign bodies. Can anyone describe this image? First of all, you should be able to describe whether it is a CT scan or an MRI. Is it a CT scan or an MRI? Why is it a CT scan? Yes, bone is better demonstrated on CT scan. So this is an axial CT scan, brain and orbit, and which shows muscle enlargement in both eyes, fusiform and tendon sparing. So as it is involving both eyes, it's most probably thyroid eye disease. This is another coronal CT scan which shows bony defect in the right floor of the orbit, most probably blowout fracture, and you can also see herniation of the intraocular contents. Another CT scan, which view is this? Which plane is this? This is axial CT scan, which is in which you can see that there are hyperdense lesions present within both vitreous cavities, which have more density than the vitreous. So this is most probably calcification, and this is a case of retinoblastoma. Can anybody interpret the CT scan? Hmm. What can you see in the CSF spaces? Hyperdensity within the CSF spaces that which are the cisterns, and it is in a butterfly pattern which is present in subarachnoid hemorrhage, in which the patient presents with a worst headache of their life. So when do we use contrast, and which contrast is used in CT scan? Contrast enhanced CT is performed following intravenous administration of Iodine rated contrast media, which are of two types, iohexol and iodexinol. Iohexol, common term is Omnipac, and iodexinol is Visipac. So it improves sensitivity and specificity of the CT scan and enhances the lesions that are present. Indications are in mass lesions like tumors, vascular lesions, carotid cavernous fistula, and other pathologies of the central nervous system. Also, in case of optic nerve involvement like neuritis, orbital cellulitis, and myocystic and it also helps in identifying abscesses in the orbit and the brain because it produces a ring enhancement. This is the ring enhancement that is seen after use of contrast, and this is a case of brain abscess. It is not indicated in the cases of acute hemorrhage because it will mask the hemorrhage and bony injury, localization of foreign bodies. It is also contraindicated in patients who are allergic who are allergic to iodine and who have renal failure. This is a case scenario. A 52-year-old lady has a history of increasing painless proptosis over the past 4 years. The CT scan is shown above. An A scan shows high internal reflectivity. What is the most likely diagnosis? Your main focus in this CT scan should be the left eye.
How would you describe this city? See, there's going to be a dome station, and this city photograph will be lying here. So you have to describe. Anybody? Dr. Mehra,
These kind of exits showing the exit view with the there is a hyper dense, well circumscribed lesion tetroburger in the left side, which is towards the median side, with the eyes glowing effect, no bony indentation. Might be cavernous meningioma. These might be
Yes.
so you have to tell the size also. What is the size?
About 10 to 15 millimeters.
This is median and slightly posterior to
Posterior.
the eyeball. So what else would you require to localize this gap?
Other views also of the CT scan.
Okay.
Further that will be
साइज क्या होगा इसका? eyeball का साइज कितना होगा?
24 axial length.
हाँ, इसका कितना?
12 to 14.
Good. चलो.
So, what is the most likely diagnosis? Cavernous hemangioma. What does MRI stand for? Magnetic resonance imaging. So, the physics of MRI is that the hydrogen nuclei or protons they align first. They align along with the axis of the magnetic field when the when the patient is placed in the MRI scanner. Then radio frequency pulses are turned on, and then these protons they rotate their axis out of alignment. And when the radio frequency pulse is turned off, then they realign with the magnetic field. When they realign, they release energy that is measured by the detector. So this does not subject the patient to ionizing radiation because magnetic field is being used, whereas CT uses ionizing radiation. The signals are analyzed and displayed as a cross-sectional image that may be axial, coronal, or sagittal. So which one is which? A is sagittal, B is axial, and C is coronal. So how to differentiate between CT and MRI from a random image? It is easy to tell the difference between CT and MRI images because bone appears white on CT but it is not clearly demonstrated on MRI. Weighting. What is weighting? It refers to two methods of measuring the relaxation times of the excited protons after the magnetic field has been switched off. It's the time that the protons take to relax after switching off the magnetic field. Various body tissues have different relaxation times so that a given tissue may be T1 or T2 weighted. every tissue has different best visualization on that particular type of image, whether it's T1 or T2 or other enhancement techniques are used. So for T1 weighted, CSF appears very black, whereas in T2 weighted, CSF is very white, and it's opposite in the case of fat. So main thing that you have to see is the CSF in case of brain, and in vitreous in case of orbit. Which one is T1 and which one is T2?
Right side T1.
Hmm. Right side वाली T1 क्यों है? So if we compare the T1 and T2 weighted images, the T1 has a high signal or produces a bright image in case of fat, melanin, blood, proteinaceous fluid like exudate, paramagnetic substances, manganese, copper. But T2 has high signal in case of water, edema, and lower signals in fat, blood, and other tumors. What are the image enhancement techniques that are used in MRI? Ji? First is gadolinium contrast. In CT scan, we used iodinated contrast. Here we use gadolinium contrast. So gadolinium is administered intravenously. It remains intravascular unless there is a breakdown of the blood-brain barrier in case of trauma. It is only visualized on T1 weighted images, and it enhances lesions like tumors and areas of inflammation. Ideally, MR should be performed before and after contrast, and the two images should be compared. So, can anyone describe this image? Hmm. Okay, so these are two images. Axial T1 weighted MRI pre and post contrast. First one is pre contrast, second is post contrast, which shows hyper intense lesions present on the outer surface of the cerebral hemispheres, which are multiple. So, this is a case of multiple meningiomas, which are enhanced by gadolinium contrast. A gadolinium injection is administered and through a small intravenous catheter that is placed in the arm vein, most probably the veins of the antecubital fossa, and it is same for CT contrast. Prevalent adverse effects are injection site discomfort, nausea, itching, rash, headaches, and dizziness, and uncommon side effects are gadolinium poisoning and nephrogenic systemic fibrosis. Fat suppression techniques, they eliminate the bright signal of fat on conventional T1 weighted MRI and they enhance the other structures that are visible on the T1 weighted MRI. So fat is suppressed and the other structures are enhanced. It better delineates normal structures like optic nerve and the extraocular muscles, as well as tumors, inflammatory lesions, and vascular malformations. So this is a T1 fat saturation image, which shows a large exophytic globular optic nerve sheath meningioma demonstrated on gadolinium contrast. Enhanced T1 weighted image fat suppressed magnetic MRI. So here you can see that all of the fat is suppressed and only the lesion is being focused upon. And similarly, here you can also see the same. This is another MRI of a patient with left optic nerve sheath meningioma. First image is axial T1 weighted image without contrast. The second image is it shows fat suppression, in which you can see that optic nerve and extraocular muscles are being enhanced. And C is coronal post gadolinium fat suppressed T1 weighted image, which shows enhancement of the optic nerve, specifically the optic nerve sheath. What is TERF? Short T1 or tau inversion recovery. It has a very low signal from fat but has a high signal from water. Optimal sequence for detecting intrinsic lesions of the intraorbital optic nerve. So it is used for two main purposes: optic neuritis and thyroid eye disease. Okay. This is a case: a 35-year-old woman with acute onset of left eye pain and vision decline. This is an axial, fat suppressed, post contrast T1 weighted image, which demonstrates enhancement in the intracanalicular, you can see over here, intracanalicular portion of the optic nerve. So, fat is suppressed and the optic nerve is enhanced. Another case, this is a stir image. A 43-year-old woman with acute vision loss and eye pain. No prior neurological symptoms were noted. This is an axial stir image which demonstrates faint increased signal in the distal left optic nerve. What does FLAIR stand for? This is fluid attenuated inversion recovery. In stir and fat suppression, we were suppressing the fat, but in FLAIR, we are going to suppress the CSF so that T2 weighted image can detect other structures apart from the CSF. Sequences suppress the bright CSF on T2 weighted images to allow better visualization of adjacent pathological tissues such as periventricular plaques of demyelination. So, FLAIR images are ordered in case of multiple sclerosis because we want to see the demyelination. This is a sagittal FLAIR image showing multiple periventricular plaques of demyelination in the case of multiple sclerosis. It is also highly effective in the detection of sulcal or meningeal infection because it enhances the meninges and metastasis that abut the border of the CSF. In this figure, first is the T2 weighted image without any enhancement technique applied. Second is proton density image, which will be discussed later. Then a third C is the FLAIR image in which you can see that the CSF is suppressed and the periventricular plaques are more enhanced. And last is a T1 weighted image following gadolinium contrast in which only the periventricular plaques can be seen. What is proton density weighted images? It relates to the number of nuclei instead of the characteristic of the hydrogen nuclei. In MRI, we were looking at the rotation and the alignment of the hydrogen nuclei. But in case of proton density, we look at the number of nuclei. But it is an old technique. It has been replaced by FLAIR. It still continues to offer excellent signal distinction in the assessment of joints because it differentiates fluid hyaline cartilage and fibrocartilage. So it can differentiate structures of the joints. What is this? Would anyone discuss? CT है या MRI है? इसके अलावा जो फर्स्ट है वो T1 है, सेकंड T2 है और लास्ट वाली फ्लेयर है. ठीक. If we compare the brightness tissue type in T1, T2 flare and stir, in T1 fat is most enhanced, T2 CSF and vitreous are most enhanced, and the rest of the order is almost opposite. For flare and T1, the order is almost same, but after fat, T1 enhances white matter, but in case of flare, it enhances gray matter. And in stir, it is similar to T2, but CSF, vitreous, and gray matter are enhanced equally. What is diffusion weighted imaging and apparent diffusion coefficient? Diffusion weighted imaging measures aberrance in expected Brownian motion of the free water. So main application is in ischemic stroke and detecting whether the stroke is irreversible ischemia or reversible ischemia. If there is an obstruction, then it is irreversible ischemia. The diffusion weighted imaging signal is bright in case of cytotoxic injury and dark and the ADC signal is dark in case of cytotoxic injury. So this is a case of lateral medullary syndrome, also called Wallenberg syndrome, in which A shows a T2 weighted sequence which demonstrates bright signal in the left lateral medulla. B is a diffusion weighted image in which you can see that it is bright. As we mentioned that cytotoxic injury causes brightness in case of DWI and darkness in case of ADC. So in B you can see brightness and in C you can see darkness. Last is Fiesta and SIS. It is a fast imaging employing steady state acquisition and constructive interference in steady state. It is the newest high resolution technique and it is used in the investigation of cranial nerve palsy. So, if we discuss the neuro-ophthalmological indications of CT and MRI, optic nerve is best visualized on coronal stir images in conjunction with coronal and axial T1 fat saturation post-gadolinium images because we want to suppress the orbital fat and we want to focus on the optic nerve and the extraocular muscles. Optic nerve sheath lesions, they like meningioma, are of similar signal intensity on T1 and T2 images, so we have to use contrast to enhance the meningiomas. In cellular masses like pituitary adenomas and other tumors, they are best visualized by T1 weighted contrast enhanced studies because in that the CSF is not enhanced. Cavernous sinus pathology is best demonstrated on coronal imaging, and contrast may be required for this. Intracranial lesions of the visual pathways like inflammation and demyelination, as we discussed, MRI is the best technique for intracranial lesions. What are the limitations of MRI? Bone appears black, it is not directly imaged, so for that CT scan has to be used. Additional investigation has to be used. Recent hemorrhage is not detected, so MRI is inappropriate for acute cerebral hemorrhage. For that, CT has to be used. And it cannot be used in patients with magnetic foreign objects like cardiac pacemakers, intraocular foreign bodies, and ferromagnetic aneurysm clips. Patient cooperation is very much required, and the patient has to remain motionless. The patient cannot move. It is poorly tolerated by claustrophobic patients as it involves being lying in an enclosed place for many minutes. So the picture on the left is a CT scan machine and the picture on the right is MRI machine. It is of two types, closed bore MRI machine and open MRI machine. If we compare CT scan and MRI, advantages of CT scan are certain MCQs हैं इसके बाद.
और next time कर next time कर
ठीक है.
Thursday को